Yeah, my name is Alberto Del Saz, and I joined the Nicolai Dance Theater in 1985, and I was a soloist with the company for about 15 years. Right now I'm teaching in two different colleges here in New York. I teach at Hunter College and I teach at Marymount Manhattan College. I teach dance technique. It was towards the end of my career that I started having problems actually with my knee. It started first, and then it kind of traveled to my back. And then I went to a couple of doctors, so they did an MRI of the hips and they found that I had arthritis and also just overuse of the joint. I lost total range of motion at one point, so it was hard for me to do normal daily activities like tying my shoes, crossing my legs, reaching for things that they were below the waist. And also just the pain became quite excruciating and constant. So I had x-rays and they told me, well, you are going to need a hip replacement. But really they left it up to me in terms of like, it's a decision that you have to make. It took me about 4 to 5 years to do all the research that I wanted to do. I even went to California to see a doctor there. I saw somebody in Las Vegas that was doing anterior surgery rather than posterior. And then finally I met Dr. Meere here in New York. And I think from the first meeting that I had with him, it was very clear to me that he was going to be my surgeon. Of course, I think there was a certain chemistry and a certain rapport with Dr. Meere in terms of like, he was very easy to talk to, he had the right answers for me. Obviously his experience and his background and his reputation as a surgeon, but also I think he was doing minimal invasion, which I think as a dancer I was really looking or investigating about the possibility of having that done because I wanted to go back to dancing as much as I could. My understanding was that there is very little cutting of the muscles. It's mostly like separating the muscles. There was very little damage to my structure, which I think facilitates the recovery. For me as a dancer, it was very important that he was going to give me a certain range of movement. Every doctor had a different approach to it, but he told me that he will give me the most range possible. So June 10th of 2005, I had a double hip replacement, and I'm very, very happy with the results. I didn't know what to face during this recovery process. You don't know what is going to happen after you wake up. So the intense pain that I had before the surgery was gone. You are given a new body, but you have to be quite diligent about making sure that you do your physical therapy. I'm teaching every day. I choreograph, I go to the gym, I take yoga classes, I walk blocks and blocks and blocks in the city. Often people can't believe that I have a double hip replacement just because what I'm able to do. So it has been almost 10 years now since my surgery, and I'm pretty happy. I was dancing last night at a show here in New York City, and yeah, he gave me a chance to continue with my career as a dancer, which was very important for me.